Hello, I'm Dr. Tim Romanowski. Thank you for joining us for the Warrior Medical Minute and learning how testosterone replacement therapy can benefit you and optimize your life.
Tim, how are you today?
I'm doing great, Nelson. How are you doing today?
I am good. I am joined with Dr. Tim Romanowski with the Warrior Medical Group. Tell me a little bit about your practice, if you don't mind.
Absolutely. So Warrior Medical Group is a direct primary care practice, which also offers hormone replacement and testosterone replacement for both men and women.
Excellent. And that's a good lead into what we're going to talk about next, and that is TRT, or well known as testosterone replacement therapy. So we're going to dive right in. I got some questions for you, Tim. Can you give us the rundown of what TRT exactly is and what it's used for?
Sure. TRT, so also known as testosterone replacement therapy, it's actually a gaining field in medicine right now. For years, it's kind of been ignored by mainstream medicine. Testosterone is one of the main hormones, or is the main hormone that drives the male body. And over the last several decades, we've noticed that across every single age group, we've been having decreases in testosterone levels. And this has produced, people becoming more sedentary, having heavier body statures, fatigue, lower sex drives. Men just are no longer feeling like men. So the goal of testosterone replacement therapy is not to go to the gym and get you hulked out, which a lot of people have that misconception due to the abuse factor, but it's actually to optimize your health, optimize your levels, and get you feeling like you again.
Excellent. So how do you figure out if a guy's ready for testosterone replacement therapy?
Sure. It's pretty simple to figure it out. It's based on symptoms. You come to me and say, hey, I'm feeling very fatigued. My muscle mass has gone down. I'm gaining a little more body fat. My libido is no longer there. I'm having some problems with my erections. My mood, it's not depressed, it's just down. These are all signs and symptoms of testosterone deficiency. Now, this may not pan out in your labs. We have lab standards that set when we can prescribe stuff, but these are based on insurance standards. And it looks at numbers, it doesn't look at the actual person. And in my opinion, we need to treat people and not numbers. So the testosterone replacement, when we look at these numbers, they become a guide for us. Okay. But what you're telling me is more important than what that number is. So if you tell me, hey, I'm feeling bad, but your numbers don't show it, and we've ruled out everything else, yes, this is testosterone deficiency, and it needs to be treated.
So if I come to you with some of these symptoms, I get tired every day at 3 or something along those lines, and you look at numbers of testosterone, can you tell me a little bit about, I know you treat patients or symptoms, not numbers, but let's talk about the numbers in what's low testosterone, what's high testosterone, what is optimal testosterone levels?
Sure. So when we're looking at testosterone, generally, if you go to your primary care provider, they're going to just test a total testosterone. And this includes every single form of testosterone in your body, bound, free, and converted forms. That's half the story. We also want to look at the free form. When we look at the standards, it also depends on which lab we're going to, but roughly about 250 up to 900, 1,000 is a, quote, normal range. That is a massive range.
Yeah.
So, when they do these studies to figure out what these normal ranges are, they literally go down to, say, Walmart, pick out the first 100 people they see, age ranges from 20 to 100, draw the blood, okay, based on statistics, put you on that wonderful bell curve. Say, okay, everyone between these two values is what we consider normal. Well, that's all fine and dandy, but what does normal mean? Yes, it's normal lab value, but how's that translate to how you feel? So if you come to me, yes, your labs are normal, but you're saying, hey, I need to take that 3 p.m. nap every day. I can't make it to the gym. I'm not fulfilled in my marriage anymore because of this. There is something wrong. And yes, your optimal levels, you're not at your optimal levels. Most men function their best or anywhere between 700 to 1,000, maybe even super physiologic up to 1,200. And we try to get you into that goal. We don't push you to really super physiological levels, that's when we get into that abuse territory. We have other side effects from that, which we're trying to avoid. It's about optimizing your levels, which then optimize your health and well-being.
Understood. Great. Thank you for that. And so what you're saying is that's the 750 to 1,000 is a far cry from what would be considered low of 250.
Mm-hmm.
Great. Thank you for explaining that. So let's talk about different ways that somebody can take TRT or how it can be given, how it can be administered to the patient. Can you explain that a little bit?
Sure. So we always recommend talking to your provider about the best way to do hormone replacement. And I don't mean the gym pharmacist, which a lot of guys have unfortunately gone to.
Yeah.
So the ways we can replace testosterone, one is through pellet therapy. This is a little bit of invasive. We do a nick in the skin, insert this device with these measured doses of testosterone pellets.
Mm-hmm.
So the device goes in, we sew you up, and then the pellets last a couple months, 6 months, and it all depends on body fat composition, circulation, activity levels, how fast they're absorbed. So it's great. We don't have to worry about dosing. Don't have to do anything like injections or creams. Downsides, it's invasive. It's a potential of infection. And then if I overdose you, underdose you, there's nothing I can do until those pellets dissolve.
Yeah.
So it's not one of my favorite versions. A lot of people do it and have success, but it's not the way I recommend it. There's another version out there which is really interesting. I'm looking more into it. I don't offer it personally. It's actually through a nasal spray.
Oh, wow.
It's dosed 3 times a day. It gets absorbed very quickly. Downside, I don't know how many people like doing nasal sprays to begin with.
Right.
And a 3-time-a-day dosing, that's a little cumbersome.
Yes.
Then the other 2 ways we can do it is through gels and creams and injections. Gels and creams are very good. We have good absorption, so you apply them to the underarm, the groin, the scrotum. Best absorption's on the scrotum. Get your levels up to a nice steady state. Dosing adjustments very, very easy. Downsides is we can have, they can be messy. You apply it topically, and then you can actually transfer it to other people. So
Okay.
you have little kids, you apply it, don't wash your hands well enough, it's applied now to your son or daughter, or it can be applied to your partner,
Right.
which can have pluses and minuses as well, because then they start reaping the benefits or the risk of the hormone replacement as well.
Right.
And then the other way to do it is injections. 2 ways we can do injections. One is through a large volume given into a large muscle group, like the glutes, once or twice a month. So very effective. This is how we always done it. Downsides is you get this nice big spike in your levels. You feel great. And then when it's time to redose, your levels have dropped very low and you have those symptoms again of being low. So a lot of people don't like that. And plus then you have to figure out how can I get in to see the doctor again, get the injection. It's very hard to do these injections by yourself. I don't know how many people can actually contort to get
Right.
it into their backside. So it's effective, but not the way to go.
Right.
The other way that I like to do it is through subcutaneous dosing. And what we do is we use an insulin-style needle, so a very small needle, very small syringe, and it goes into the subcutaneous tissue, so right under the skin, so belly fat, back of the arm. We can even do it in the thigh. And we do this 2, maybe 3 times a week, depending on what our goals are, what your symptoms.
Okay.
Very easy to adjust the dosing from shot to shot or long term. Risk here is it's a pinprick. So a little bit of infection, a little bit of pain, but most people don't even notice it.
Right.
So very effective. So in my opinion, doing injections through the subcutaneous route or the creams or gels is probably the best way to go.
Great. Thank you for that. And it sounds like it's the more consistent way to keep it into your body.
Exactly.
Great. So what are the big wins that men can receive from TRT? And also talk about the risks or side effects of TRT.
Let's start with the risk and side effects.
Okay. Yeah.
So a lot of these came out from some studies done way back in the 70s. The biggest one that there's still a black box warning on is it can increase the risk of prostate cancer. So yes, we give testosterone, it does stimulate the prostate. We see some spikes in the prostate-specific antigen, the PSA, which is the blood test we use. But we also have to break that down, make sure it's not related to a prostate infection or prostate cancer. There are actually big centers right now that are treating aggressive active prostate cancer with TRT and having amazing results.
Wow.
And these studies about testosterone being bad for the prostate actually came about because they used to castrate men as treatment for prostate cancer. Remove the testosterone, things improved. Well, not so much. So that's one of the big risks.
Yeah.
The other risk that everyone worries about is blood clots, because we know that giving testosterone will thicken the blood, or quote, thicken the blood. So let me give you a little scenario here. This is very equivalent. So I take you up to, let's say, Denver, Colorado, and have you start training like an Olympic athlete.
Yeah.
Okay. Bring you back down here and I test your blood. I see that your blood levels have now spiked. So we're talking about your hemoglobin, hematocrit, and your red blood cells. That's the only thing that spikes because you're trying to capture more oxygen because of the environment you were in. Same thing happens in testosterone. But as a medical community, we don't understand that. And what people think is, oh, this is a marker for a type of blood cancer, which causes the clots. Well, in order for that to happen, we need the clotting factors to increase, and specifically platelets. It does not happen with TRT. So we still warn people about that because it's out there in the literature.
Right.
But our thinking is slowly changing on this, and this is getting out there a little bit more.
Understood. So it's really not a risk.
It's still a known risk, but it's not a big risk as people make it out to be. Yes, we're giving you testosterone, your levels are low, kind of get you through puberty again. You could have some acne breakouts.
Okay.
Yeah.
Interesting.
But benefits wise, again, it's about optimizing what your health is. So it increases your energy levels, increases motivation. There are good studies showing that by giving testosterone, it crosses the blood-brain barrier and actually improves mood and anxiety in men. We can improve muscle mass and we can decrease fat in men as well.
Okay.
Of course, the big ones increases libido and sexual performance. That's what most of us are after with it.
Great. Very nice. So some tremendous upside.
Tremendous upside.
So what are some other lifestyle changes? If I'm on TRT, what are some other things that I can do to help underpin and make the TRT work better?
Sure. The best thing we can do is it's diet and exercise.
Okay.
So a good diet, I recommend doing like an anti-inflammatory diet or even a Mediterranean style diet, helps keep all the inflammation down, which can improve testosterone levels.
Okay.
Exercise, especially strength training of large muscle groups, especially the quads, can actually help us improve testosterone levels.
Okay.
And sleep. Testosterone pretty much is made when we have high quality sleep. So if you give testosterone, your sleep improves, your testosterone levels go up even more. So it's a nice balancing act. So it's that clean, healthy living, getting away from processed foods that surround us, unfortunately, in our environment.
Right. Yeah. And good sleep helps everything, doesn't it?
Good sleep helps everything.
Right, definitely. So how does TRT have an impact on things like bone health and brain function?
Sure. So one thing we mentioned was that the testosterone can cross the blood-brain barrier and help with mental health, improve mood, improve anxiety. Is it a cure? Absolutely not. It just improves those things.
Okay.
So when we talk about bone health and cardiovascular health, the interesting thing is testosterone is converted to estrogen in the peripheral body, so body fat. Men do need estrogen. So this estrogen protects the bones. So when, say, a woman's going through menopause and they start developing osteoporosis, it's because they lack the estrogen. So the estrogen comes in and helps protect the bones, and the same thing happens in men. It also can the estrogen can help reduce cholesterol in men and be very cardioprotective. Same thing happens in women with estrogen levels. So there's this fine balance that we have to do with estrogen. Some people will tell you that, nope, you're a man, you don't need estrogen, let's block it.
Yeah.
Well, we just talked about why we shouldn't block it.
Right.
Other people say, just let it go. Okay, well, there's risks for estrogen in men. One, you can get development of breast tissue. The nipples can become tender, which is very concerning for most men. So then we have to block it that way.
Okay.
For me, I'm kind of a wait and see person. I give you a little bit of leniency about where your estrogen levels should be. If they get too high, yes, let's have the conversation and block. But like I said before, I treat patients, I don't treat numbers.
Right.
If you come to me, your estrogen levels are a little bit high, just a little bit out of the normal range, but say, hey, you know what? I'm developing breasts. My nipples are really tender. I can't go running because it just hurts so much. Then, okay, let's test your levels. Okay, we need to start blocking your estrogen.
Got it.
It's finding that proper balance.
Right. Very good. So what's the deal with TRT in men's fertility?
TRT and men's fertility, interesting question. So we talked about how there's a decrease in testosterone levels across all age groups. So giving actual testosterone for someone who's younger may not be our best option.
Okay.
Especially if there's concern for fertility. So when we give testosterone, what we do is we're essentially telling the testicles to stop functioning because they don't have to work hard anymore. You begin a dose from somewhere else, the signals are now turned off for the testicles to make testosterone. So your fertility goes down that way. So if you come to me, you're 25-year-old, it's like, hey, me and my wife, we want to have kids. By having all these symptoms that are low testosterone, can I get testosterone? No. We go to some other chemicals, something called enclomiphene or gonadorelin, which work on the pituitary, so the major gland in the brain, which sends the signal down to testicles to make sperm and testosterone. And these two medications help to push the testicles a little bit harder and to keep up their function.
Aside from that, are there any long-term effects of TRT?
Long-term effects, so better quality of health, better quality of life is what we're all going for.
Right.
I mean, we want to be able to live into our 80s, 90s and being just as vivacious as we are now.
Right.
Am I going to get you back to how you feel in your 20s? Probably not, but I don't want you to be walking around and acting like a 80-year-old when you're 20.
Right.
Or even when you're 80. I want you to live your full life. So yes, testosterone does improve these things. It gets us that vitality back.
Excellent. Love that. So how do you customize a TRT plan for each person?
So the big thing with customizing TRT is, what are your goals? Let's sit down, let's have this conversation. Like I said, we don't use testosterone because you tell me, hey, I want to be the biggest guy in the gym.
Right.
No, that's not the goal. How are you feeling right now? Is your sex drive not where you want it to be? Is your mood depressed? What's your motivation like? We have to fix these things, and that's the goal. So we look at your labs. Yes, the labs are our guide. Start you on a dose. Come back, retest your levels. Tell me, how do you feel? It's 6 weeks later. Oh, I've noticed this improvement. It's not where I want to be. Okay, let's bump you up. So anytime we make a dose adjustment, we reconnect, find out if there's improvements, if there's side effects, and fine tune that to where you need to be. It's not cookie cutter medicine, unfortunately, which we all would like to do because it's just plug and chug. This is a conversation. This is very personal to everybody.
Right.
So let's get this tailored to what your needs are.
That's great. So what does that process look like? So if I'm experiencing some of these symptoms and I come into your office, so walk me through timeline, walk me through what the process looks like for me to get treatment.
So it all starts with a phone call.
Okay.
Call the office. We will direct you to our website to fill out our new patient questionnaire. The questionnaire just gives us a history of your medical background, social history, so we can start figuring out what factors we need to modify. Bring in for a consultation. If there's time, sometimes we'll try to get labs ordered beforehand so we can review those on your first visit. Labs take between 7 to 10 days to come back.
Okay.
Then we sit down, talk about each lab in depth, and figure out how these are affecting your life, how, if we start testosterone, how they're going to change, and how you're going to change, and figure out what that goal is and how we can optimize those levels for.
Excellent. Sounds pretty simple and quick.
Simple and quick.
Excellent. And that's what I like.
Yes.
So with you also being a direct primary care physician predominantly, I'm sure that you probably find other health needs while you're pulling these labs as well.
Absolutely. Have people come in where they've had untreated high blood pressure, or they didn't know they were diabetic, or even sleep apnea.
Oh, wow.
These things have never been explored. One, because they've gone to their primary care doc and primary care doc didn't have time to talk about any of these. I mean, most people seek us out for the testosterone side because no one is listening to them. I want this level checked, but my doc won't do it. It's like, well, your doc doesn't understand. Let's have the conversation.
Excellent. Excellent. So, in summary, are there any important notes to make for patients that are looking at possibly using TRT?
Important notes. So first, lifestyle. Everything we do is a lifestyle change. So getting that proper exercise, the proper diet, proper sleep goes so far to helping your testosterone levels. One, being open and honest about your medical history so we know how to properly treat you. and then just be willing, be vulnerable in that conversation. Yes, it's uncomfortable. As guys speaking, we don't like going to the doctors because we don't feel heard or listened to. The whole idea of we're a Warrior Medical Group is we're here to listen. You are part of our family, so we want to take care of you. You're the expert in you. I'm just the consultant. How can I know what's going on if you don't tell me?
Right. Exactly right. Well, that's great advice, Tim. I appreciate you walking us through what TRT is and how it can positively impact our lives. Really appreciate it. We got Dr. Tim Romanowski with the Warrior Medical Group. Thanks so much for joining us.
Thank you, Nelson. It's been great. Hope to see everybody in the office.
Awesome. Yes, sir.
Thank you for joining us today for the Warrior Medical Minute and learning how we can help optimize your health.